I'm actually really fortunate to work with a great group of radiologists and a great group of technologists that really care about what they do. And I think the nice thing about being here at Cambridge Health Alliance is that the entire breast care team gets together every week. We discuss care of all of the patients that come through, and we want to make sure that everyone is getting the best care that they can get. As the director of the breast imaging department, I want to make sure that we are able to provide the same service to a patient that comes here as really anywhere else. And we have been able to keep up with that technology. So we have new machines. All of our equipment has been upgraded over the last probably about 5 years. We make sure that we keep up to date with the equipment. And in radiology, that's actually really important because new equipment means that we're able to diagnose things that are maybe smaller in size. And the purpose of breast cancer screening is to be able to diagnose a cancer that's as small as possible, because that's when the treatment is the most effective and the least harmful. Breast imaging is a little different than the rest of radiology in the sense that you have more patient contact, and I love that part of it. I think that that's what drew me to the specialty of breast imaging within radiology. I think just being able to see patients through the day, being able to interact with them, I love to hear the stories that patients have to say, and I think that just drew me to this field. So women often come in worried about the number of exams that they're getting. They are worried about the radiation risk, primarily when they come into the radiology department in general. And what I can tell them is for MRIs, there is no radiation. And I understand it can be a very stressful experience. It's a longer study than a normal mammogram is. The position that the patient is in is a little bit uncomfortable, but our technologists are great at working with patients to make the experience as comfortable as possible. We have specialists that are specific to breast imaging. So our radiologists are highly trained in breast imaging. They have a lot of experience, years and years of experience in breast imaging. The nice thing also here is that we actually have specialists that cover all aspects of breast care. So we have surgeons, we have oncologists, we have pathologists, social workers. I mean, we have everything every specialty that can cover breast health right here. And so a woman really doesn't need to go anywhere else to get any of the care. We can do everything from start to finish right here, which is great.